Good morning. What brings you in today?
Good morning, doctor. I've been experiencing pain in my shoulder when I try to lift my arm or reach overhead.
I understand. Shoulder pain during overhead movement is quite common and may be related to the rotator cuff muscles. One important muscle involved is the supraspinatus, which helps initiate arm elevation. Today, I will assess it using a clinical examination called the Empty-King test, also known as Job's test. The Empty-King test is a clinical shoulder test used to assess the integrity and function of the supraspinatus muscle and tendon. It helps identify conditions such as supraspinatus tendinopathy, inflammation, or partial and full-thickness rotator cuff tears.
So this test checks if that muscle is injured?
Exactly. It helps us determine whether the supraspinatus is contributing to your shoulder pain or weakness. Let me briefly explain the anatomy involved so you understand what we are evaluating. The supraspinatus muscle is one of the four muscles that form the rotator cuff, which stabilizes the shoulder joint. Origin: the supraspinatus originates from the supraspinous fossa of the scapula. Insertion: it inserts into the superior facet of the greater tubercle of the humerus. Innervation: it is supplied by the suprascapular nerve, mainly from the C5 and C6 nerve roots. Function: its primary function is to initiate shoulder abduction, particularly the first 15 degrees, and it helps stabilize the humeral head within the glenoid cavity during shoulder movements.
So it helps start lifting the arm?
Yes, exactly. If this muscle or its tendon becomes injured, patients often experience difficulty or pain when lifting the arm. Supraspinatus injuries are among the most common shoulder problems, particularly in individuals who perform repetitive overhead activities. These injuries may occur due to degenerative changes with aging, repetitive overhead movements, overuse during sports or manual work. The supraspinatus tendon can be injured through several mechanisms such as repetitive overhead activities like throwing or lifting, sudden trauma, such as falling on an outstretched arm, chronic shoulder impingement leading to tendon degeneration.
I do a lot of overhead work at my job.
That can certainly place extra stress on the rotator cuff, including the supraspinatus tendon. Some factors increase the risk of supraspinatus injury, including age-related tendon degeneration, repetitive overhead sports like tennis or swimming, heavy lifting occupations, poor shoulder mechanics, or scapular dysfunction, previous shoulder injuries. Patients with supraspinatus problems often report pain on the lateral or upper part of the shoulder, difficulty lifting the arm, weakness during overhead movements, pain when lying on the affected shoulder. Typical signs and symptoms may include pain during shoulder abduction, reduced shoulder strength, painful arc during arm elevation, eye pain, difficulty performing daily activities such as combing hair or reaching overhead.
That sounds very similar to what I'm experiencing.
Yes, those symptoms can indicate involvement of the supraspinatus. However, shoulder pain can arise from several other conditions as well. We also consider possibilities such as rotator cuff tendinopathy, subacromial impingement syndrome, biceps tendon pathology, adhesive capsulitis, acromioclavicular joint disorders. That is why a thorough physical examination is important. During the physical examination, I will assess your shoulder range of motion, muscle strength of the rotator cuff, presence of pain during specific movements. These assessments help determine which structures may be involved. I will also palpate certain areas around your shoulder, including the greater tubercle of the humerus and the subacromial region, to check for tenderness or inflammation around the supraspinatus tendon.
Okay.
Now that I have explained the anatomy and possible causes of your symptoms, I will perform the Empty-King test to specifically evaluate the supraspinatus muscle.
All right, doctor.
Learn about the Empty-King test, a key assessment for shoulder rotator cuff injuries. This test helps diagnose injuries by focusing on the supraspinatus muscle and tendon. Empty-King test overview targets the supraspinatus muscle and tendon to identify rotator cuff problems like tears, tendinitis, or impingement. 1. Patient abducts arm to 90 degrees. The patient actively lifts their arm to a 90-degree angle to prepare for testing. Arm abduction to 90 degrees. Visual demonstration of patient's arm abducted correctly to 90 degrees, showing proper positioning for the test. 2. Examiner applies downward resistance. The examiner pushes down gently on the abducted arm to test strength and elicit pain if present. Downward resistance applied. Visual showing examiner pressing downward on patient's arm to assess strength and pain response during the test. 3. Hand and fist with thumb out, shoulder internally rotated 30 degrees forward. The patient clenches their hand with thumb sticking out, shoulder rotated forward at 30 degrees to mimic the empty kin position. Empty kin position. Visual of the empty kin position with thumb oriented downward in the scapular plane highlighting correct form. Empty kin test summary. This test isolates the supraspinatus muscle, revealing pain or weakness that indicates rotator cuff injury. Use the empty kin test during clinical shoulder assessments to better diagnose rotator cuff issues. Thanks for watching. Empty kin test procedure video.